So Jordan, how was your week?
My week was lovely, thank you. Had some really lovely news at the start of the week. One of my best friends had a baby.
Oh,
Yeah, so
amazing.
little boy, he's gorgeous. Yet to meet him, but hopefully the next couple of days I'll meet him. I can't wait. Yes.
That's such lovely news.
Yeah, really lovely. And that was it. That was all the excitement for the week, really.
Yeah. Plenty of excitement there.
That was it. That's me done, really, for the week. Yeah.
So Ali, how was your week?
I had a really good week, a busy week, but really good.
Classic.
Yeah. I mean, it's kind of life right now, but it's great because so Jin is our lab tech that started with us, and she's in the process of ordering everything she wants. So we don't have a fully working lab. Her first job is to set up the lab, and the really cool thing is, we don't have to use lab work or labs like we always have. We get to forget how dentistry uses a lab, and we get to think about how we want to use it, and that's been really cool because we're not going, okay, so we follow this order. We're going, how can we integrate Jin into our workflow in the best possible way? So she's coming into surgery. She's been part of a few implant surgeries. She's been there for consultations, and we're trying to figure out how we take what we're doing and improve it, which is awesome. And as part of that, I'm really excited. We are the first facility in Europe, I believe, to get Micron Mapper, which is part of Naviden, which is photogrammetry, which I think we've touched on before, but essentially we can screw these flags on to implants as soon as we place them, and full arch implants, which intraoral scanners are not accurate for. And Naviden's camera can see them, and literally within seconds, we have accurate implant positions to microns, which is amazing. And this technology exists and people are using other forms of it, but this is part of our system. And I love that we are basically beta testing this for Europe, which is awesome. And then it was a busy week because on Monday, producer Simon and I spent a day filming for W&H. And
One of our esteemed sponsors. Of the
yeah.
podcast.
And what a cool team they are, because they always support whatever we want to do. But they asked us to film something, which we'll release soon. But speaking from an auto cue, and I look at people whose job is to just like read something off a screen, and I'm like, they have it easy, because then they just go relax whilst things are being set up. I was knackered. I couldn't speak by the end of the day. I mean, even Simon was feeling sorry for the talent. And the thing is, I'm such a diva because I was feeling so sorry for myself. And Simon's the one who's like setting up the cameras over and over again and in a bad posture. But actually, it made me realize how tiring it is just to concentrate, and how I'd rather be doing surgery all day than do that. So yeah, it was a great week. How was your week?
I've been asked to do a couple more sustainability talks.
Awesome.
Looking at mainly sort of promoting the sustainability sort of award scheme that I brought into this practice. But I found it so useful. So I'm very happy to go out and do a little bit more promotion for the Green and Primary Care Wales framework. And I would highly recommend any practice sort of think about signing up for it. It is predominantly aimed more at NHS practices, but private practice can do it as well.
Brilliant.
So that was
Congratulations. Amazing.
Thank you.
Amazing.
And yeah, now looking at us also doing a bit of sedation. So
Yeah, well, tell everyone the story about what's happening with that.
So Ali said for a while that he would like to have sedation available for the full arch cases, and you were looking at doing it yourself, but realised that it would be a lot of that concentration brain power to try to be doing all of the surgery and focusing on a patient on the sedation side of it.
Because I have to mention someone. When I went to Bournemouth to mentor over there, we had a sedationist called Sabrina. She's Zach's sister, and I didn't mention her name last time I talked about this, and I felt bad because she was amazing. But she spent the whole time screaming "breathe" at a patient, and it changed the way I think about sedation.
Ali went, I know it'll be great at shouting "breathe" at patients.
I refuse to scream "breathe" at someone for a few hours, but Flo would love to do this.
Yes, so I'm going to do an IV sedation course.
Awesome.
Yeah, I'm excited. Another thing to learn how to do.
And for me, working with people that you trust and care about patients, and having another string to our bow within that framework here is really exciting. So yeah.
Yeah, exciting times. So this evening we are honoured to be joined by a senior dental nurse who has not only been Ali's nurse, but is also currently working as a dental nurse with me too. She's worked as a dental nurse for the past 12 years in both NHS and private practices, and is, in a very biased opinion, one of the best dental nurses out there.
Agreed.
Her journey has taken her from smaller local practices to ensuring that Ali passed his foundation year, to being a head nurse with further training in phlebotomy, radiographic, and TCO training.
And that doesn't really pay homage to Jordan's soft skills as well, because Jordan signed up my first 10 Dentplan patients as well, if I recall correctly. And actually, Jordan can sell anything, especially if she believes in it, I'd like to think. But yeah, on top of all of that, she's also just great with people, which is amazing. So
yes, Jordan Matthews, thank you for joining us on the podcast.
Thank you for having me.
It's all right. Why did you become a dental nurse?
Oh, it was a total fluke, really. I just went for a checkup in my local dentist, and I got talking to one of the nurses, which is now actually one of Ali's nurses, Kai.
Oh, wow.
Yeah.
Okay.
And she said, might have a job coming up for you. Are you interested? And I thought, oh, that's amazing. Yes, I'll go for it.
That's another person that can sell anyone anything.
yeah,
So now she sold you dental nursing.
I learned from the best.
Amazing.
So I worked there then for about 3.5 years.
Oh, wow.
Yeah.
I love the fact you went in for a checkup, came out with a
Yeah,
job.
with a job. Yeah, unexpected, really. I never thought about dentistry ever, but I'm really glad I done it.
Oh, fantastic. And how did you find sort of all that studying and the exams and things?
I loved the studying, actually, because I was really lucky, and I think being a dental nurse for so long now, I've seen loads of girls go through their training, and I don't believe that any of them have had such as good as training as what I had, both in surgery and out, with my training agency. It was faultless, they were amazing. I just really enjoyed it.
So has a lot changed from the way you trained to be a dental nurse to what people are doing now?
Yeah, everything's online, or seems to be online. And I just loved going there every Tuesday. I think it was in the evening, every Tuesday evening, because you were there and you had the girls around you and you had your tutors, and I just think it's really valuable doing it like that rather than online now,
I suppose there's quite a lot of that disconnect, and it's then trying to fit it into your night. And I know lots of people, they're just trying to study this and then do everything. It's probably, it's quite nice probably having that space every week.
Yeah, definitely. Yeah.
We kind of become a shortcut culture in that sense, that if I can quickly do it online, but then we forget what we lose.
Yeah.
So I was talking to someone about the fact that when you go somewhere and you sit down for 10 minutes together to do something, when you go on a Zoom call, you get on the Zoom call, you do the call, you get off. But if you get there and you're having a cup of tea for 5 minutes, the conversations that you have and the connections that you make are completely different, and the impressions that people leave on you. So yeah, I completely understand why.
100%.
I just also can't believe how much knowledge they give dental nurses.
Yeah.
I had when I first started, I had a trainee dental nurse, and she kept asking me questions. She was like, "Oh, Flo, what's the answer to this one?" And I'm not gonna lie, a couple of them I was like, "I have no idea." This is stuff that we were doing, and I was like, "Wow, that's so intense to be then having to know, and then be in charge of sort of making sure sort of all the equipment and everything's right in practice." It's a lot, a lot to
It's
learn.
very in-depth, and it was when I was training, but I feel like they try to overcompensate it now because it's online, so they're trying to throw all this information, whereas we had loads of information, when we were training, but when you break it down, your exam, it's just, you just get a few questions, it's not,
a bit more manageable.
100%, yeah.
So the really important question: how was working with Ali?
I loved it.
Oh, bless you,
We had so much fun. Every day was just a massive laugh, isn't it?
Yeah, I wouldn't class working with me as a massive laugh though. No, it wasn't a bit intense.
No, it was great fun. I think you gel with people, don't you? And we really gelled, and yeah, I loved working with you.
No, me too. And I have to say actually, I learned a lot about a lot of what we do here in the nursing structure we have and the type of people we look for. A lot of it came from a handful of nurses that I worked with, and I always say, like, you, Natalie, Lauren H, and now Tash, who still works with us. Like, there's a lot there like, such incredibly capable people that brought a lot of personality to what they do and really cared. And I think it made me really think about how we build a place around that, because actually dental nurses are absolutely at the heart of a practice. You mentioned it there. Everything from the cleanliness and sterilizing through to like the way the place is organized, the chairside care, the stock. Like, what is there in a dental practice that could happen without dental nurses?
Yeah, that's so true. But you've always really valued your nurses as well, you know, like you've always been the biggest cheerleader for your nurse. You know how valuable they are, and not everyone is like that, you know. So that's why people do gel when they work with you. Because
I guess part of the reason is because I don't know how anything works.
Yeah,
I don't know where anything is, right?
You just need to do your bit, and the nurse does everything else. Yeah.
No, I do find that always awkward, particularly when you start somewhere new or something, and then they're like, oh, if you've got like another nurse that comes in and they're like, oh, where's this? And I'm like, I have no idea.
I still do that now, Flo. I had to come in, it was a few weeks ago on a Saturday, and there was a patient who had chipped a full arch bridge, a temporary bridge. And I was just looking through the drawers, and I said, I'm sorry, I'm going to have to phone someone who knows what they're doing. and I phoned one of the girls. I was like, where is any of this? And yeah, it's amazing, because actually, the strangest thing I found in dentistry is that I came out of dental school not really understanding a dental nurse's role in a dental practice, not chairside, but in a dental practice. And I think that should be more a part of the teaching for people to really appreciate the roles within practice.
Oh, definitely. Yeah. I do. Yeah, I think maybe at dental school there could be, because a lot of it is you nurse just for each other. And it's that you're doing, it's more just the suction or learning that whole, actually how important like stock rotation and things are, and that ordering side of it.
Behind the scenes.
Yeah. No, there definitely should be more on that. You've done some extra courses?
I have, yeah. I can't quite remember. I've done imps with Ali, ROS, radiography, phlebotomy.
Those are the big ones, George.
Yeah. I think I don't really use ROS now. But everything else I sort of...
You might be, if Flo's going on an implant course, so you might be using it again.
Yeah. I've done a few,
You know what you're doing.
I know what I'm doing.
Yeah. You ever nursed for an implant before, Jordan?
Oh, millions. Yeah, millions.
Yeah.
You did Ali's first implant, is
first
this right?
implant, yeah.
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 And you were there, and you were giving me what... you can tell the story.
So she was really sweet little old lady, and we just had like a tiny little room, and we just done it. I really didn't know what I was doing, I don't think.
And I was pretty sure you knew what you were doing. You were handing me what I needed, so I was just using whatever you gave me, and it turned out great.
Yeah, it was fine. It done the job,
How did you find the phlebotomy course?
Yeah, it was nice. I really enjoyed it. It was over a weekend. I think the first day of it was the theory, and then the second day was a practical, not on people, just on like a fake arm. But one of the girls I work with now went on one the other week, and they had to practice on each other, and I'm so glad I never went on that one. I don't like that.
And not volunteering.
No, I'm good behind a needle, but not on the other end of one. No.
Do you think that that's something that more dental nurses should consider doing? Did you enjoy the course, and did you enjoy taking blood afterwards?
Yeah, I enjoyed the course. There was coursework after it, but then I think we already had the accreditation after the course, so you had to do the coursework. But when it's like you've done it now. Do you know what I mean? It's like you've got to drag your feet and do your work. But yeah, I was quite nervous doing the bloods after it. I can't remember when. It's like a lot of things, like implant nursing, for instance. You go in and you're really nervous because you're new to it, and then one day you do it and you don't even think about that. You're just used to it. But I love taking blood.
So what do you take blood for?
Not much now where I work because we don't really do implants. It'll just be more hormone testing, stuff like that, because we've got a doctor, that works there, so he'll do it for that. But that's all really. So I don't do half as much as what I used to.
And what would dental nurses be doing this qualification for? What kind of things would they be involved in if they do phlebotomy?
Well, I only ever used it in dentistry for implants, so PRGF and
blood derivatives.
Yeah, that was good. Done a couple of vampire facials with it as well, actually. Yeah.
Gosh,
Yeah.
that's not for me.
Yeah, not for me, but definitely one I'd give a try.
Yeah.
On which end?
Not yet.
Doing it or being the one receiving it?
Being the victim. Couple of years, absolutely.
Fair enough.
Maybe you'll be Flo's victim
Yes, actually, that'd be
Vampire facial.
That'd be fun.
We can arrange that. What do you think sort of makes a really good dental nurse? Sort of the qualities and things.
They've always got to be one step ahead of the dentist, because I think if you're, thinking on the same level, the dentist is already asking you for things. Do you know what I mean? Where it's got to be in front of them, and that's what I got drummed into me when I was training. I think that's quite a good quality I got from my training. Is always being one step ahead, being really productive. Thinking outside the box and being a team player. Because I think it makes a massive difference. If you've got that skill, being a team player, you're really valuable then to the team. Whereas if you're just a really good nurse in the clinic, but not a team player when the girls need you, it doesn't quite work.
So what kinds of things, because this is the bit we don't really get to see behind the scenes.
Yeah.
What types of things makes your colleagues, the other nurses, good team players, and what are the kinds of things that you've seen or you've done maybe and learned from that mean that it doesn't work as part of a team?
So if you share surgeries, topping up the drawers at the end of the day, that's good, because if someone else comes in the morning and there's nothing in the drawers, that's really frustrating. Also, I used to work with a dentist and I loved him. He was amazing. He was the sweetest man ever, but he'd always run late into my lunch, or, you finish at 5 o'clock and then you had half hour to clean down and then you could leave at 5:30, and I'd always be running over and it'd be 5:25 and it'd be an army of girls coming in then, because the patient's just gone and then all the girls are in, sweeping, mopping, helping me. Yeah.
That's awesome.
Yeah, it is. And I think it's really important to be like that as a dental nurse, because it is predominantly quite female-led, isn't it, And, girls can be a bit bitchy sometimes. So I think if you're not pulling your weight or helping, it doesn't go unnoticed then. And I think
Get found out pretty quick.
100%, yeah. And I think there's friction then, because everyone's helping and everyone's doing things, but one or two isn't, and... Yeah.
So do you think that there's things that practices can do to promote this teamwork culture, or do you think this is an individual decision?
I think it's an individual. I think you're born with it or you're not, really.
Okay.
I think, if someone's not a team player, you can say, oh, look, you need to help like this, or you need to do this. But some people just don't have it, Most people do, though, which is good.
So you don't think going and beating each other up on a self-defense course helps with the teamwork?
I wasn't there for that, so no, I was, I was in the Maldives, so I was having a great day. It does, because it bonds the team together. Absolutely, I think team bonding days are really, really important. Definitely, in no matter what you do, I think.
Yeah. For some context there, just for our listeners out there, the practice that Jordan and I work at, we did a self-defense day as a team, and we did learn a lot. And apparently, I've got a very good natural punch.
I'm not surprised.
Not that I, more of a pacifist would ever really use it.
The best thing is I have a list of colleagues, all female, that I would call if ever I get involved in a fight, and you're not on that list. Yeah. I just say, Kai's on that list.
100% top of my list.
Tasha's on that list.
Yeah.
No's on that list. I'd call you as the hype man, Jordan.
I don't think I'd be any good.
No, but actually, Jordan, I'd say that's one of the biggest things that you bring into a dental team, because actually, when especially you've worked with some people towards the end of their careers who are big names. You've worked with people at the start of their careers, and actually, you've encouraged everyone. It doesn't matter who you've worked with, and I don't think everyone realizes the power that dental nurses have to help a clinician and to be part of that journey for them. And I think the fact that you're like, oh, I believe in you, you can do this. You say that to everyone all the time, and actually, you're never disingenuous. You find reasons to believe in people. You find the good in people. So I actually think like you're a great hype man. You really are.
No,
You really are.
I regularly go to Jordan with my with my career dilemmas. Like, Jordan, I don't know what to do.
And what does she say?
She's very supportive.
Yeah. So Jordan, what kind of personality types or what type of people do you think make good dental nurses then?
Sense of humour.
Yeah.
Yeah. Fun,
Yeah.
a chatterbox. Maybe not too chatty because, it's a
Knowing where
fine
the line is. Yeah.
Just a nice person, just helpful, nice, sweet, hard worker.
And what kind of, if someone's considering becoming a dental nurse, what types of things, because you're a senior nurse, that's nothing to do with your age. That's to do with, that's now your experience and your role. So, what types of responsibilities do you have? What does your day look like? Everything from what a nurse would do at the beginning of their career through to the things that you do because you're more senior.
I'm not in surgery as much now. So, at the start of my career, I was the only nurse. It was only 3 of us. It was me, the principal dentist, and Kai.
Yeah.
And so I was always in surgery, and then I moved up into Cardiff then with Ali, and I was always in surgery then. Then I was head nurse, so I was sort of out of surgery a bit more for all the paperwork and stuff. I'd go in when needed, and then where I am now, I'm not really in that much now. I do a lot more paperwork. We've got a trainee dental nurse now, so she's in there quite a bit. But I do.
What
like
type
to
of
go in there.
paperwork are you dealing with?
Policies. I love a policy, Radiography file is another favourite of mine. And just like the daily running, making sure everything's running, and
I think what's very impressive at the practice is there's a mix of paper and digital notes.
Yeah.
So it's quite intense
Yeah,
paperwork.
double
quite
the work.
literally.
Yeah, double the work. It's really good. I really enjoy it. I think that's more me now, is admin and all the paperwork than in the surgery. I did go in surgery in the week and I loved it because, I don't really go in there much, and
So what type of practices have you worked at in your career? Because you're now in a place where you're helping run a practice, right? What types of jobs have you had? What types of experiences have you had that have shaped you as you are now?
So my first job where I trained, I think that really shaped me as a nurse. And I think, if I went somewhere else to train, would I be how I am now? I don't think I would. He was really particular in a good way.
Yep.
And I think I learned everything from there. And then obviously, when I went to more of a specialist practice then, I picked up everything I didn't know from there. And to be more of a perfectionist. I think I am a perfectionist anyway, but I think that really shaped me to becoming like really OCD perfectionist. And then where I am now is we got a bit of everything going on there. We got dental, we got facial aesthetics, and we do ortho there as well. So I've learnt ortho, and going there and starting there was a bit like, oh my God, I've never done this before. But that's my favourite treatment now, really, ortho. I love it.
Would it have been easier to just stay in one place?
Yeah, no, actually. It would have, because where I was working, it was 2 minutes away from where I was living. So it would have been. But no, because I'm never, at that point, I knew I needed more. I wasn't quite like, I'm one of them that always got to be uncomfortable. Because if I'm comfortable, I just need more then, So I just like to be pushed, so yeah.
So what would you suggest to any dental nurses who maybe they feel like they're comfortable, it's easy, they know what they're doing in their day, but they're not loving work. What advice would you give them?
Move on. Definitely, you know. And I think if I could have changed anything with my career, it would have been move on earlier, because where I am now, I'm so happy. You know, I got the perfect work-life balance, and like the girls are amazing, the owners, they're like my family, you know. It's just the best place that I've ever worked. And I could have missed a trick there, you know, if I had stayed. So yeah, if you're not happy, life's way too short to just stay in one place.
Did you ever wish you'd gone and done like hygiene or anything like that?
Not so much hygiene. I think about it because I could have done it, you know, but it never was an interest to me as such, you know. The stuff behind hygiene, so the reasons why you have your hygiene and periodontal disease, all that I was interested in, but like
doing a scale and polish,
yeah,
it's not what got
numerous times a day. I don't know, you know. Yeah,
It's a really good point, because I think sometimes people don't think about. People think about whatever it is, the training or the job title or whatever it is, but they don't always think about, would I want to do this all the time? Because that's what your life is. Your life is doing the thing that you train to do, right?
Yeah.
And I think, do you think, I don't know, maybe it's not really my place to say, but I feel like a lot of maybe dental nurses feel like that is the progression and it's a way to increase your pay, but maybe don't think about what that day entails.
Yeah, I agree with that. Definitely, I agree with that. I think if I was to have ever gone down that route, I probably would have chose to do therapy, because you've got the mix of the two then, rather than just the one.
Has this come from you nursing for DCPs and seeing what their day's like?
Yeah, pretty much, yeah.
Okay.
Yeah.
Okay. So, if someone is in that position, they're thinking, okay, I've listened to Jordan and I'm not particularly happy where I am, and I'm taking the safe way out. What kind of advice would you give if someone phones you and says, I'm going to look for a new practice? What type of jobs, what type of practices are you recommending people look for?
I think it depends where they are at that time and what they actually want from a practice, if they want to stay in dentistry or not. You know, there are practices now that are really heavily facial aesthetics, do you know what I mean, in that field. Like mine, for instance, you know, we do a good mix of the two, so you could always go down that route and, you know, work somewhere like that, or somewhere like this, you know, more specialist. Yeah.
And in terms of, because not just in terms of the clinical work, but you're now helping to run a practice. You've been in practices where you've been happier, maybe haven't been as happy. What types of things are you looking for in the place you're working?
A work-life balance.
Okay.
I think more than anything, yeah.
So what entails a work-life balance to you?
You've got time at home.
Yeah, yeah.
You know, because like, you know, where I've worked before, it's been super long hours and weekend work, you know, and we do some weekends, you know, but it's not like,
It's not
you
too
know,
much.
it's not too much, and the hours are amazing, and they're really flexible, and it's give and take. Like, I know you're really good like this, Al, like with your staff, is if you give, you know, you more inclined to be given back, you know. So yeah.
Yeah, the start time is a very nice start time.
What time do you start?
Could be anything, 8:30, 10:30.
Nice.
Go off
Nice.
at half
Whenever
10.
Jordan turns up.
Basically, yeah. So I'm a bit sleepy, going a bit later. But it's, you know, it's nice and chilled there, but everything's done.
You've got a workload
Yeah.
that you manage.
Whereas, you know, if it's not give and take, people aren't going to work as hard for you.
Yeah.
I think I know, like the Danish model is very much more towards that, and I think it would be hard to implement in lots of dental practices, but actually they've got that whole model of actually if the work is done, why are you then sitting around?
Yeah.
And you know, if you've got family things going on, take
Yeah,
that time because actually you're going to be more productive. And I appreciate obviously with dentistry we have appointments. And
This
things,
is the
it's
problem,
hard
isn't
to implement.
Because you'd love to implement, like, you know, all these places that have gone to 4 working days and paid for 5. But the problem is there's appointments. This is the whole problem in our profession, isn't it? So it's a question of, at the moment, there's a there's a crisis of dental nurses. Now, it's weird because I don't think there is a shortage of dental nurses. I think there's a shortage of jobs that dental nurses want,
Yeah, I agree
personally.
with that, 100%.
And I think that it's interesting because people like you who've been in the industry, who have climbed up to be doing big picture things, you're the people who have the ability to voice what would help, things like work-life balance. It gives practices an indication that, hey, if you're not getting applicants, maybe these are the things that you need to address.
Yeah, definitely. Yeah, massively, like hours, and also pay.
Yeah.
You know, like, I don't know why, but dental nurses don't get paid very well. Not everywhere, obviously, but, you know, if you do look at an advert for a dental nurse, if they do list the money, it's really low.
So talk to us about what have you earned throughout your career? Not necessarily now, but what types of pay have you had? Has it been hourly or monthly?
Hourly.
Hourly. And what kind of hourly pay have you been getting through your career?
I'm really happy with my pay now.
Yeah.
But
Helen, if you're listening, Jordan's very happy.
could do better. Yeah, but you know, where I was before, it was a real highly stressful job, and the pay was really, really low.
Okay.
You know, I went in on my job where I am now way higher.
Okay.
You know, and I didn't ask for that. That was just the
What
pay.
was offered?
Yeah.
Because let's put it, if there are practices out there who are listening and they're struggling to recruit dental nurses, what are the types of hourly rates that practices need to be considering for dental nurses to be able to have a life where they don't where the money isn't the issue, or where they're not competing in a race to the bottom, where they will find that lots of nurses apply?
I don't know really. I couldn't, without actually looking into what everyone pays. But I know minimum wage is quite high now, isn't it?
Well, it's still it's higher than.
But dental nurses are probably about that, you know?
Yeah. I think what I found like quite crazy when I started it was you had, particularly with the trainees, some of them on, because of how young they are going in as well, and obviously with the whole minimum wage it's even lower, and some of them were on basically apprentice wages, and then they're having to do all that studying as well, and there is a lot to learn, and I was like, I couldn't understand why you wouldn't go and work in a supermarket and be on minimum wage, higher than this, and then you're not having to study. And I think there is this whole problem there. Yeah. And then, I mean, definitely an issue I find is that recognition that even sort of within the NHS side, they're not recognised as nurses a lot of the time. Like, it's quite hard getting like blue light cards and things like that. And they're not brought into that conversation, but they really should be.
Yeah.
But
it's a hard job.
Yeah.
You know, and I think, you know, there's a lot of money in dentistry, as in treatments cost a lot of money, but that's because materials cost a lot, you know, and the skill of the dentist. But then if the dental nurse is just getting paid minimum wage, or, you know, I don't know, £10, £12 an hour or something, and, you know, without them, you couldn't have earned £3,000 in an hour doing an implant. Do you know what I mean? And I just think, be fair.
I think that's really a very fair thing to say, actually. And actually, I think what you find is as minimum wage is caught up with even what like experienced dental nurses were being paid, I think what we find is that the people in dental nurses genuinely love dental nursing. Like, they all know that they could earn better in a supermarket, but there's a reason they're not going to that. They want to help people. They want to be part of healthcare. They care about the processes within a dental practice that they are responsible for. And so I think it's our responsibility in dentistry to be recognizing the role of dental nurses. I think that's really important. And I think if you don't, you end up with a dental nurse is either going to be the reason why you have a great day, your room's productive, and you do life-changing treatment, or it's going to be the reason why you stop liking your job. And I don't think people understand that enough or recognize that enough.
Yeah.
So yeah.
Yeah, so true.
I've just Googled it. Over 21 is £11.44 minimum wage.
Yeah.
8 to 20, 8.60, and then under 18s and apprentices £6.40.
Yeah, I wouldn't say they're on much more than that.
I mean, there are practices that have a model, and it's part of their business model to hire under 18 and train them because of those wages. But the other problem I've seen, and it's why when we have had someone younger, for example, one of our nurses' children came to do work experience, and she was so good, she stayed on as a trainee, and we just said, well, we can't pay you different because we don't expect different.
Yeah.
She didn't have any less responsibility. You are still responsible. If a dental nurse does not do their part properly, someone can get ill, someone can get hurt. And so how can we say, well, here's much less money? And so I think there is a disparity there.
Yeah, I agree. You've got to be fair, haven't you?
Oh, definitely. I've never understood why there is that younger you are, that you've got a different minimum wage. So
I
it's
guess
very archaic.
I don't mind it if there's going to be a job with little or no responsibility or effort, you know? I get it. Like, I don't know, you lie there so people step over and avoid a puddle. Cool.
Yeah.
That's very low responsibility. Don't move, right?
What a random job.
Because honestly, I can't think of a job that doesn't matter, if I'm honest. So I
But
can't
that's what I
find a way
mean,
to justify it.
There's so few out there, and I appreciate they're doing it to try to, so there's then companies are encouraged to then employ
Yes.
them, but actually jobs are there because they matter. There's some sort of cog in some sort of machine, so I think it should be fair whatever age
I
you
agree.
are.
Yeah.
I agree.
But you said work-life balance. Do you have any hobbies?
I do, yeah. I love yoga. That's my favourite thing at the moment to do. It's really nice. And just going to the gym and also eating. You know, like
I like eating too.
I love eating. Like I love going out for food and trying new places. Love that.
Do you think the yoga does help with I appreciate you're not doing as much nursing, but I remember that from studying at one of the nurses. They said you should do yoga and Pilates. It'll save your back.
Yeah, I agree with that. Actually, yeah.
Have you had problems with your back?
Now and again, but more my shoulders.
Yeah.
My shoulder blades, yeah. So since doing yoga, touch wood, it's been okay.
Okay.
Yeah.
Maybe all the nurses should get some yoga sessions.
Yeah, that would be awesome. I mean, it's a good way to start the day, really, isn't it? Like to do, there are ideas. Yeah.
Flo, don't do this on camera.
They're not gonna forgive you now.
No, what when you don't?
Yeah.
With some yoga. Have you tried any nice restaurants around Cardiff? You're gonna go away from that.
Oh,
You're always taking pictures in nice restaurants.
I know. Yeah. I mean, I love a steak, so pasture's really good for steak, isn't it?
Oh, this is
unbeatable.
Flo's not gonna like you mentioning
Yeah, no, I know.
places that are not sustainable.
Yeah, okay, forget I said that. No nice restaurants.
Restaurants are all terrible.
Yeah, I don't like restaurants.
Oh, do you guys go out for meals or drinks much as a team?
We go through phases, really.
Yeah.
Obviously, every Christmas we do something. Maybe once or twice throughout the year, then we get to do something. Not as much as what we'd love, but everyone's got so many different things going on. It is hard to round up everyone.
How much of a difference do you think it makes to team dynamics because obviously there's a dynamic in surgery. How much of a difference do you think it makes for practices to be doing things outside of surgery socially?
I think it makes a massive difference to it for the good. You know, it is team bonding, isn't it? And I do find when we do, so even if we don't go out for food or drinks, like we will do some team bonding sessions. You know, we are all more productive after it. So yeah, it's really important. But we are really lucky with our team as well. You know, we got a really amazing team.
What do you put that down to then?
I don't know. I mean, the owners are amazing, and we are all like really good friends, all the girls. We're all on the same page.
Mm-hmm.
Yeah, so I think that's what it is, really. It comes from the top, doesn't it?
Yeah, so maybe good recruitment, but also the
Yeah.
fact that you're all good people and make it a good
Yeah,
environment to be in.
we're all very much the same, you know.
I think it's important. It's important because I think there's going to be dental nurses listening to this who maybe don't have this and are in an environment that maybe everything isn't so friendly and there isn't as much teamwork, to know that there's different out there.
Yeah.
But also for practice owners to know that this is something that has been created,
Yeah.
that there is a culture within the
Yeah.
practice that
Yeah.
people are thriving in
Yeah.
and enjoying and
That's
are productive in.
Yeah, and no one really leaves, you know, you retain your staff that way. You know,
So if there's a practice out there and they need a Jordan, what are they advertising for?
oh,
I'm putting you on the spot here. It's not what would pull you away from where you are.
Yeah.
It's there's someone young, ambitious, qualified, who's struggling with their work-life balance, who feels underappreciated. What do you see in a job ad that makes you go, you know what? I want to give this place a try.
the hours, list the hours if they're good,
Yeah.
you know.
Yeah, or make them good.
Yeah, make them good, because I think if I was to look for a new job now, I'd want to know the hours more than anything.
Okay.
You know, but that's just because it's important to me.
Yeah.
I think for most people, like particularly with families and things, actually having either some sort of flexibility or even maybe some. Do you think you'd be open like to more like rota systems, so it wasn't so, 9 to 5, even if your opening hours are 9 to 5 every day, but having some days where you did start at 11, and so like people had that option, or a day a week where they could finish at 3 to pick up their kids or something, but still the pay wasn't affected.
Yeah.
You know?
We like that now, with a rota system, and it makes so much difference. If I'm on a 10:30 start, I can get up and do the gym and then go to work, and then you're back then, and it makes a massive difference, rather than just being like dead set to something, the same time every day.
So there are more flexible jobs out there is another thing people need to know.
Yeah, 100%. 100%.
Well, thank you so much, Jordan. I've really enjoyed this chat.
Thank
Before
you.
you go, we do have the dental quickfire quiz
lovely.
that we ask all our guests so that you can earn your dental pearl.
Okay.
It's not a real pearl, but
That's weird, right?
It's my pail.
you're gonna have to get something.
I want my
mate.
pail.
To buy you some pearls. That would
That'd
be
be
lovely.
nice,
Which is your favourite procedure to nurse for?
Anything ortho now,
Anything.
but I used to really love implants.
Fair enough. Is there a specific thing in ortho, like a bond up, or
No, not really.
no?
Just
Are you happy with a wire
anything.
change?
I love a wire. I think I'd favour a wire change.
Fair enough.
Yeah.
Which is your favourite scrub colour to wear?
Fuchsia pink.
I was like, I know exactly which one she's going for.
I love my fuchsias.
With no context, which is your favourite tooth?
A baby's first tooth.
Oh,
That's a
really
nice
sweet
answer. Yeah.
And if you were just leaving school now, what do you think you'd want to do, sort of with all the knowledge you have?
Move abroad.
I like that.
That's not even a job, Jordan.
Oh, it's a job.
No. I mean, what would you want to do? Get out of here.
And work.
But why move abroad? Why would you want to do that?
I had a taste for it before and I loved it. The lifestyle was so much better. The sun.
Where were you?
Dubai.
Yeah.
It makes a massive difference waking up and it being sunny, and warm, and
Would you have dental nursed? That's not a word. Would you have been a dental nurse abroad?
when I was living there, actually, I could have. I just needed to change my license from GDC to DHA, but I wasn't bothered to do it.
Yeah.
So I think that actually taught me something that I maybe wouldn't have done that had I.
If you were to go back. So would you have is there a profession that you go, oh yeah, I could do that every day?
I'd love to be an architect.
Cool.
Yeah.
I love that.
Yeah.
Brilliant.
Right, well, thank you so much for coming on.
Thank you.
Really
Thank you.
enjoyed it. It's
Thank
been a
you. Thank
real
you
giggle.
so
Thank
much.
you.
Yeah, thank you.
Thanks. Ali, why did you invest in the Navident dynamic navigation system?
It's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the dental imaging company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or 2-dimensional, and also all their surgical supplies like Ustamed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the PiezoMed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support. Crown Dental burrs have a rota system, and what that means is I have the same burr box every time with the same burrs numbered. I ask my nurse for the number of burr rather than having to remember the name of it. And it also means that when I need a new burr, we go to the box which has this card, and if we are running out, my nurse can just scan the QR code and order the same one. So we never have problems with inconsistencies with burr boxes or burrs. Thank you very much for implementing this for me, Paul. I love it. And the other thing I love is that Paul's a problem solver. So I worked with him to curate this alveoplasty set, which he has such great knowledge for all of his burrs. And it means that we have everything we need for full arch surgery. So whether you have a problem with your set and need this set, or you have a problem that you need help solving, Crown Dental Burrs will help you do it.